Welcome to the Right Physical Therapy Show. Someone used to be here with us. There he is.
You're not by yourself anymore.
Welcome, Tyler.
Don't steal that. Welcome to the Welcome to the Right PT Show. Super excited to be here. Cade and Tyler here.
Yes.
Like, it's been a while. I haven't been on Facebook Live in a long time.
Yeah, he was suspended for 4 weeks.
Yeah, suspended for 4 weeks for inappropriate language. I'm back. I've learned my lesson.
Yeah.
So
it's fines.
I'm Tyler Billings, Doctor of Physical Therapy, co-founder here at Right PT. Cade Anderson, partner at Right PT, Doctor of Physical Therapy, OCS, Orthopedic Certified Specialist. We're always going to announce that because it's important and it sounds cool.
It does, yeah.
Cade is part of how many in the company? 13?
OCS? 14.
14 OCS certified, meaning we are the certified specialist in orthopedics.
Mm-hmm.
And so that's what we're here to talk to you about today. If we want to talk about something like, Cade would never talk about golf because he doesn't know much about golf. So we're going to talk about orthopedics. So before we jump into the question, you have a bit of announcements.
Oh yeah, so we've been talking about our Stuff the Backpack campaign, which we love. It's an opportunity to bring in school supplies that we can donate to the local communities, to the local schools here. And we have the rest of this week and next week left before we're going to be turning those in.
Nice.
Today, I actually want to give a shout out to Gem State Paper and Supply.
Thank you,
Ryan Anderson, he's a great man. He came in, he brought us a bunch of stuff, a big pile, truck full.
Super exciting. So, Stuff the Backpack, how does that work in our clinics? Tell them a little bit, like, for the local community, like, what do they do?
So once we get those, so we take those donations. Once we get them, we take them either, depending on the area, we have contacts with people in each area. It'll either be to the school district itself, to specific schools, or here in the Magic Valley in Twin Falls, we take everything to the Valley House. And that gets directly given to kids in the local community. So it's not being sent off to somewhere where it's going somewhere random nationwide or you don't know where it's going. This is going to kids specifically in the area that you're donating in.
Nice.
So,
that's super cool. I'm grateful that we're part of that. And every year we've done this for years and years and years, and it's fun to see
Gets
all
bigger
the
and bigger
kiddos that it impacts.
Yeah.
Maybe we should do a Facebook Live on how to carry the backpack, which I'm sure we will, because those backpacks are bound to get heavy. It's crazy how heavy
the school shopping list this year was like, you saw it.
Yeah,
we're big.
And you know what that is. When it's time for back to school, what sport is right around the corner? Football. Thank you. So we're back into the same question. We got asked this question again. We felt it's good timing to swing back around to answer that. And that is, what is sports medicine and what's the role of PT in that? A lot of people say the word sports medicine, and what does physical therapy do as part of that role? We've gone and reached out to a lot of our local physicians in the many areas that we serve, Eastern Idaho, Magic Valley, and Boise, and we talked to them about this question and their thoughts, and so it was fun to talk to the sports medicine groups and to get their take on things as well. So I'm going to tackle the first part, something that is pretty close to Cade and I, is what's the difference between a physical therapist and an ATC, athletic trainer? So what's the difference between the two? We get questions, personal trainer, there's multiple things, so it's important to clarify. I'm surprised that we get this question asked so much, but I get it, right? It makes sense. So a physical therapist is trained and certified in doing rehabilitation, right? We always make this joke. Anytime someone says it's rehabilitations with an S, or rehabs, if someone says I'm doing some rehabs, then turn and run away, because that's not rehabilitation. So rehabilitation, there's a specific criteria that the school has to meet in physical therapy, specific testing and studying of the body, looking at cadavers and really understanding the musculoskeletal system, right? Understanding the science of that. So a physical therapist has different training than an athletic trainer. I know that very personally because I've done both athletic training as an undergrad, the full-blown athletic training, and obviously a physical therapist, a doctor of physical therapy. So I've seen the two realms, right? We had some classes similar in undergrad where we would study ultrasound and we would study taping techniques. But when you get into PT school, it's very specific on how do you rehab the tissue, the tendon, getting to the root of the problem. There is minimal taping in PT school. It's about how do we do a grade 5 manipulation, how do we load the neck, the spine, how can you prevent injury, rehab it, and help someone return to sport. So it's a very specific niche, where an ATC, what I always say is an athletic trainer is trained to get you off the field safely, because trust me, you would not want me to do that unless I'm trained specifically, like Xavier Beckham and Boise and others that have sports certified specialists.
Mm-hmm.
So you can be a PT and have a specialty in sports that really trains you in the emergency situation. So an athletic trainer is very well trained in how to deal with the emergent situations out on the field. Someone's down, face mask. You're not just going to flip that person over. You're going to know how to, assess a spinal cord injury, neck injury. So an athletic trainer takes you out the field safely. A PT gets you on the field safely. You'll probably notice an athletic trainer doing some taping. We've all been there. Cade, you've been there. I've been there. Where they help you manage and get through what you need to, right, to get through a season. An athletic trainer is really well at that, of managing issues and helping you stay in the game, right? When there's a little minor issue, they can help you with that. But when it comes to rehabilitation, it is legally our duty as a physical therapist to direct that care. An athletic trainer can help with that. If we're guiding it and directing it, we can give things that need to be done on the sideline, things to specifically get there for. But an athletic trainer, per the government rules, cannot bill out for rehabilitation services, because that's not what they're certified in.
Yeah, which makes a lot of sense. And my personal experience, when I was in high school, my athletic trainer, Mike Burgraff, if you're watching this, Mike, you're the man. I love you. You helped me through a lot of stuff. When I was in high school, I had a lot of problems with ankle sprains. I was spraining my ankle every single game. It was unbelievable, right? Just every single game, and I had problems with shin splints throughout the season. I'm talking specifically about the football season right now, but common problems with, like I said, ankle sprains and shin splints. Now, at the time, he helped me a lot. He really helped me manage my symptoms. He did a lot to tape me. We'd tape me before the game. I'd come back at halftime. He'd retape me. If anything ever happened during the game, he'd come back, he'd retape me, he'd do whatever he had to do. He always had ice ready for me. Like, without him, I wouldn't have been able to get through the season, honestly. And so I'm really appreciative and love what athletic trainers do.
But now, I'm not, because you beat us in football, Skyview High School.
Yeah,
rivals. That's not cool.
Well, I'm sorry. I'm not sure what to tell you on that one. Go Bees, right? But in all reality, now looking back on it, at the time, I still have problems with this a little bit, but I had what's referred to as a partially compensated forefoot varus, meaning I'm a very supinate position with a very high arch. I walk a lot on the outside of my feet. Now that was probably just genetics, and that's the way I was formed as a young child, right?
It's the roads in Honeyville.
It's the roads in Honeyville. They're always slanted, and so I would always walk on the outsides of my feet, right? But that's what I had, right? Now that was the root of the problem. And so everything I had was in relation to that issue that I had going. That was the root of it, right?
Yeah.
When you walk on the outside of your feet in a supinated position, the ground reaction force forces you into an inversion or a lateral ankle sprain, right?
Yeah.
And so it was obvious why I was continuing to sprain my ankles. It didn't have anything to do with I was a weak person or anything like that. I didn't have good balance. It's that I had the position of my foot was causing me to get into that. And then I had a lot of strain from the anterior tibialis, the peroneals, different muscles, the soleus, that would cause shin splints, right? And so that was the root of it. The problem I had is that while I had somebody that was there to help me manage my symptoms, I didn't have anybody that was there to get to the root of the pain and help me move better. And that's how this should work. A physical therapist, we are the movement experts of all of healthcare. Like, nobody understands the musculoskeletal system and the way the body moves better than a physical therapist. And so we can determine, hey, the reason why this pain is occurring is because of the way that you're doing this or the way you're doing this. We can look at movement patterns and figure things out, and we can make adjustments there, right? In this particular case, my athletic trainer, Mike, again, he was awesome. He helped me with a lot of taping and different techniques to help with the inflammation. And he even would send me home and say, hey, I want you to go home and try and balance on one foot. And he would give me some exercises to help. Yep. But I needed so much more than that. I needed so much more load. And it's not his fault or anybody else. I didn't get what I needed. It was my fault for not going and finding everyone on the sports medicine team that could help me. Because that's the thing. Everyone plays a role within the sports medicine team, right? And if there's one thing I could tell you, if you ever have somebody, whether it's an athletic trainer, whether it's a physical therapist, whether it's a sports med doc, that tells you, I'm the only one that can help you, don't go see anybody else because I'm the only one that can, they're doing you a disservice. And really, they're less interested in you and your well-being and more interested in them, if that's the case. Because we all have different roles within the team, right? An athletic trainer, a physical therapist, a sports med doc should all work well together. And when that happens, it's the perfect synergy to where we can really make really good gains with people and get people what they need. But it's when you feel like, oh, I just only got to work with this athletic trainer or only work with this physical therapist, whatever it may be, that's when you get into problems. And so my suggestion would be synergize with lots of different people and make sure that you have the expert in whatever it is you need doing that for you.
That's great. So what is sports medicine? Sports medicine is a branch in the medical world that deals with prevention, the rehabilitation, and the return to sport of an athlete, right? It's specific to an athlete. Sports in general is a different field, right? Even sports rehabilitation is different. It takes different equipment, it takes different energy, it takes a lot of different things to look at. Sometimes it becomes so heightened. You got coaches and parents and athletes, and the athlete's so eager to get back to sport. And so you have to really manage that with a team. It really takes a village to get an athlete back to sport, right? So who's part of that sports medicine team? First of all, you got to have a sports physician, not just a physician. You need a sports, fellow trained physician. They have the specific nuance on how to deal with concussion, how to deal with emergent situations. You definitely want a sports medicine doctor, right? An MD. You're gonna have an athletic trainer, highly valuable to have an athletic trainer. Shout out to all the athletic trainers in the regions that we work with. They do such a great job. What they do, I watch them on the sidelines. High stakes for them, right? They deal with a lot of things. They don't get a lot of credit for what they do, and they put in a ton of hours. So thanks to all the local ATCs. Then you have a physical therapist, right? We've already talked about that. That rehabilitation pillar is huge for the PT and also the prevention side of injuries. And then you got the coach, the athletic director. They always have to be involved, always. If not, it turns into a nightmare. We've seen that. You gotta have that involvement. And then the final one is the parent and the athlete, right? You can't forget about the athlete themselves. Sometimes you get making all these decisions and the athlete's not involved at all. That's not good either. And as well as the parent. As you can imagine, it's high school time. We got a lot of seniors coming in, and it's a very sensitive thing, and it gets quite emotional if you don't handle it well. So that's why I say it takes a village to bring an athlete back to sport.
Absolutely. So I think main takeaways, like we said, a physical therapist has the ability to rehabilitate an injury to help get you back to sport. An athletic trainer has the ability to get you off the field safely and take care of any emergent situations. When those two work together, it can be a beautiful thing.
Yeah, really. And I got into the PT world based off of two ATCs. Thanks J-Dub for sure, Joel Bass down at Weber State. But watching how they dealt with it versus some things that I was taught in the classroom. I'm not gonna lie, I was taught some things in the classroom like ATCs and PTs butt heads that's absolutely shouldn't be the case at all, right? And there's sometimes this talk of like ATCs and PTs don't get along. Not in our case, right? At Right PT, we definitely see the value of how an ATC works, and that's what eventually got me into the PT world, was watching two ATCs work really well with PTs. We had PTs at Skyview High coming into our gym along with the ATC to make sure that we were taken care of, and that's why I was able to dunk on Box Elder.
It didn't help you win more games, but it sure helped you guys with the injuries.
Too bad you never beat me at Box Elder. It's cool. Basketball. Let's talk basketball.
Yeah.
But no, thank you for being here today. That's the take-home message for us is, ATCs and PTs that work together do really well in helping the athlete get back to sport. Sports medicine is more than I played sports in high school. It's far beyond that. A lot of people want to talk about I do sports medicine too because it's fun, it's sexy to say sports medicine, but sports medicine is prevention, rehab, and return to sport, and you better know what you're talking about in all three of those arenas.
Absolutely.
Anything else, Gabe?
I don't think so. Rebecca, were there any questions we missed or anything?
Nope, no questions.
Rebecca, any questions from you?
I don't have any.
All right, we answered them all. Hey, have a great day. Look us up at rightpt.com for any of our 14 locations if you have questions on prevention, rehab, or return to sport for your athlete.
Yeah.
Thanks.
Go Beast.